Next, we're going to be hearing from Jenny Green from Interior Health Authority on heat alert and response system lessons learned from a rural BC perspective. Jenny is a team lead with Interior Health's Healthy Communities program. She works with a team of environmental health officers and community health facilitators that collaborate with Aboriginal, local, and regional governments to improve the social and built environments through community design, land use planning, and the development of health-focused policies and bylaws. Jenny has over 14 years of experience building partnerships, mobilizing knowledge, and fostering collaborative leadership to strengthen community action for public health. So she will be speaking our language. Jenny began supporting community heat response planning and engagement in 2018 and continues to support heat preparedness throughout the interior of BC. So please please join me in welcoming Jenny.
Green? Okay. Hello, everyone. Good afternoon. I'm thrilled to be here today to learn about all of this emerging research in the field of heat and smoke climate adaptation, and I'm happy to share with you today practice-based learnings and using a healthy communities approach for heat response planning in a rural context. Oh, that was easy. Okay. To begin, Interior Health recognizes and acknowledges that we are collectively gathered on the traditional, ancestral, and unceded territories of the 7 Interior Region First Nations. Our region is also home to 15 chartered Métis communities. And it's with humility that we continue to strengthen our relationships with First Nation, Métis, and Inuit people across the interior. I'd like to also acknowledge that the initiative I am speaking about today took place on the traditional territory of the Nklapama Nation. So my goals today are to share the lessons learned from heat planning and adaptation within an interior rural community, and to spark some ideas about how multi-sectoral engagement and community-driven processes can support climate adaptation and resiliency. All right, here's some fun facts about the interior. I acknowledge that we have participants here from all over the province and country, so I'd like to further situate the interior of BC, recognizing our vast geography, including the many rural, remote, and First Nation communities. So we have 59 municipalities, 10 regional districts, 54 First Nation communities, 15 Métis chartered communities. Our largest community and municipality is over 125,000, and I'm wondering if anybody knows which community I'm speaking of. It's in the Okanagan. Close. That's our second biggest. Yeah, Kelowna. And then our smallest community and municipality has around 195. It's probably a bit more now. Can anybody guess which one that is? Mm-hmm. It's in the Kootenays. Good guess. So the village of Slocan. So this graph illustrates that the southern interior has some of the hottest communities in BC, and we saw many references throughout the day to many of our interior communities. And so this shows the highest monthly maximum temperatures for the month of July between 2013 and 2021, and you can see the interior region and communities in orange. This slide depicts the maximum day temperatures and number of days of extreme heat events in the interior during the June heat dome. So several communities experienced extreme heat conditions for up to 7 days. And then I must also acknowledge the devastating wildfire in Lytton that happened days after they broke the record for hottest temperatures ever recorded in Canada. So My talk is really about heat illness and deaths are preventable, and adaptation measures can be effective in protecting Canadians. It's hard to multitask up here. I'm doing several things. Okay, so the HARS demonstration project. So this shows you kind of how it's laid out, and there are 5 major components of a HARS. Community mobilization engagement, alert protocol, communication plan, community response plan, and an evaluation plan. And it's important to recognize that implementation of HARS may not look the same in every community. And it's definitely not a one-size-fits-all approach, but the process and elements associated with developing a HARS may be applicable to different climate-related planning processes. So this slide outlines different roles the health sector and public health can play in community-level climate adaptation and mitigation. And for the HARS demonstration project, and essentially a public health intervention to prevent heat-related illness and death, the Health Authority endeavored to create supportive environments and strengthen community action as described in the Ottawa Charter for Health Promotion. And while it's important for the health sector to be involved in HARS and different community planning pieces, it should be community-driven to ensure successful implementation and ongoing sustainability. So that brings me to the development of the HARS in Ashcroft. So developing HARS in the interior region of BC required a different approach, as existing tools and recommendations often target larger urban centers, and these approaches may not be applicable in rural settings where resources and capacities are different. So in 2018, Interior Health embarked on a multi-year project with funding from Health Canada to support the development and implementation of a HARS in the rural community of Ashcroft. So knowledge acquired through this initiative has informed an Interior Health HARS toolkit that was published in 2020, and I'll show you that towards the end, as well as heat planning workshops in other rural communities throughout the interior. So why Ashcroft? Well, Ashcroft was chosen based on the historically high temperatures with a dry and semi-arid climate. Ashcroft also met the criteria for small and rural, so the 2016 census showing a population of over 1,500 people. The closest urban municipality is Kamloops, which is a 94-kilometer driving distance. Interior Health has well-established relationships with the community, and the village staff and council were enthusiastic to participate in the project, especially with the high proportion of the population over 60 years of age. So it's almost half the population is over 60, as per the 2016 census. So now I'm going to begin unpacking the HARS framework. So community mobilization and engagement. So in advance of community engagement, the medical health officer and the director of our Healthy Communities program went and presented to the village council to talk about the heat impacts and to propose the project. And they also met with the village staff to discuss how we might work together. Then in collaboration with the village, we introduced the heat response planning initiative, which involved developing a multi-sectoral community stakeholder committee to help guide the project. And this was comprised of local and regional government partners, so the village, regional district, Emergency Management BC, public health representatives, community members, and organizations such as nonprofits, volunteer coordinator, fire, paramedic, police, and surrounding First Nation members. Then we followed up with several community engagements, hosted with stakeholders to share information about extreme heat, its effects on health, identify populations that are vulnerable to heat, discuss the unique context of the community, including mapping existing assets that could help prepare for extreme heat events, as well as defining a bit more what the stakeholder roles might be in supporting the heat response. So the alert protocol is So Ashcroft uses the existing heat alert thresholds established by Environment and Climate Change Canada and the BC Centre for Disease Control. And so in the southern interior, a heat warning is issued when the temperatures are at or above 35 degrees for 2 consecutive days, and overnight temperatures are at or above 18 degrees. The alert issued by ECCC triggers the activation of the community response plan within Ashcroft, and then Interior Health also monitors these alerts for surveillance purposes. The community response plan utilizes existing partnerships, physical and communication infrastructure to support the community and individuals take protective actions against extreme heat. The level of response from the community depends on the anticipated length of the heat event. Increased length of the event results in higher risk to the population. So in Ashcroft, the plan is tiered into 3 stages based on level of activation. The figure on the right outlines the response actions taken when a level 1 heat advisory happens. And then the Village of Ashcroft also has protocol checklists, which were developed to support implementation of activities by staff at each response level. Ashcroft's communication activities are implemented by the municipality, such as education for staff and materials are disseminated to community stakeholders about preparedness for extreme heat. One of the biggest takeaways is that the committee said, let's have physical copies put in everybody's post boxes, which is all in their post office, so seniors would definitely receive them. And some of the key messages that were created and distributed was, who's vulnerable? Please take time to talk to your neighbors and identify residents who require assistance during lengthy extreme heat events. There may be people who don't have air conditioning, so watch out for that. People may watch out for people who have limited or no form of transportation, what the symptoms of heat illness is, and how to avoid getting sick, along with information about cooling centers and their Voyant alert system. So a few kind of takeaways from this process was understanding how to best communicate heat messages in their community. So for example, you have to seek a balance between not enough and too much information, in order to avoid message fatigue, especially during the summer months when there's concurrent emergencies possibly happening. And secondly, it was recommended that the word alert be avoided, as it was flagged as a potential trigger in creating anxiety within the community due to recent threats from wildfire. So the term advisory was chosen instead. So evaluation is a key component of the HARS to ensure it's working effectively. Ashcroft HARS is reviewed annually to identify areas for improvement around communication methods and response activities. A questionnaire was adapted from Health Canada's guidebook to assess the HARS design and delivery, and that was in 2020 with the pandemic, so that it was kind of tweaked a little bit because of the pandemic restrictions. And preferably, a comprehensive evaluation process would include community stakeholders from all sectors, including in-person focus groups with vulnerable subpopulations that meet regularly, such as the seniors group. So lessons learned, so I'm going to sum this up. Communities play an important role in preventing heat-related illness and death through coordinated planning and action. So establishment of the committee enabled commitment, diversity of perspective, and efficient communication methods. It was imperative that the plan be simple, concise, and considerate of the community's unique context. And so the rule-based HARS planning must take into account resource availability and allocation. So Ashcroft at that time had 1 full-time and 1 part-time employee in the office who could dedicate time to the project. So to minimize the burden on limited resource base, the HARS plan was embedded in existing physical and procedural infrastructure. So the tiered response levels that you saw on the previous slide were adapted from the local water system emergency response plan. And then when we talk about educational materials and tailoring them, it's important to understand how to best communicate with each community as well as each population. The municipality plays an important role in disseminating information, especially during emergencies. So, as I mentioned, paper flyers were preferable for reaching out to the seniors population. And then most recently, the village adopted the Voyant Alert system, and I believe many, if not most, of their population has subscribed to that. And then other considerations, and some of these were discussed in previous presentations, but understanding exposure to heat stress, community capacity and strengths. So strong partnerships, collaborations, volunteers are critical to preventing health risks from heat. Cooling centers, cool outdoor areas, and other supports. Cooling centers look different in rural communities, and it depends on what's available with physical infrastructure. So cooling centers might include places where residents already spend a lot of their time. It could be Tim Hortons, could be places of worship, could be libraries, could be senior centers, or outdoor green spaces and beaches. Engagement communication channels. There's consideration around caregivers and community groups in these communities who may play a critical role in raising awareness and doing wellness checks. And then special populations to consider in a rural context could be outdoor workers, so whether that's tree planters or agricultural workers, tourists, and people who are camping. And when we talk about competing priorities and emergencies, rural communities are often on the front lines of adapting to climate change and responding to climate hazards. And so having rural-centric emergency response plans are critical. So this kind of reiterates everything I was just speaking to. Heat-related illness and death are preventable when risk is understood, and there's a combination of individual, community, and policy efforts to prepare for and respond to extreme heat. Okay, these are some of the resources available. The first one, which might be really hard to see, is the Village of Ashcroft HARS, which is available on their website under their Extreme Heat tab. We also have the Interior HARS Toolkit that I mentioned from 2020, and that's also available on our website under Extreme Heat. And then for more details about the Ashcroft HARS process, you can find more information within this Canadian Journal of Public Health, Development and Implementation of a Heat Alert and Response System in rural BC. So I'd like to acknowledge that this work and its learnings have contributed to the evidence base around extreme heat in a rural context and would not have been possible without these partnerships and individuals who joined us on this exploratory journey to seek out locally relevant strategies and approaches to prevent heat-related illness and death. And with that, I say thank you.
Questions? Sarah. And Matthew, let us know if there's anything online. Go ahead, Sarah.
Thanks very much, Jenny. What happened during the heat dome?
Yes, we're actually doing a post-heat assessment currently with Health Canada funding to see what happened and how it worked.
Can I ask for the teaser trailer? I mean, you must have some sense at this point of how things played out.
Yeah, from our interviews, it sounds like it went well, and it's working well for the village, and they're looking to kind of hear or to kind of evaluate how it went, especially during the heat dome. But that's all I've heard so far.
Okay.
Yeah.
Thank you.
Thanks for the talk. I'm just curious what your perception is of the reception and utilization of cooling centers in the communities you've worked with? Are people keen to use them, or is there resistance? Could you elaborate?
Yeah, last year we saw many communities mobilize cooling centers. And the common sense, or what we've heard, is that they were mostly underutilized. And there could be a lot of reasons for that. I'm sure there's a lot of research out there coming out around this, but it could be because they're not low barrier. You can't take your pets. You know, are they culturally appropriate, culturally sensitive? And many of them closed at 5 when we know heat continues to rise overnight. So I think there are definitely things that we need to consider and look at to improve those, or cooling centers, and also looking at options, whether closer to home or different options available in communities and outdoor spaces.
I've got a couple. So, I mean, you spoke about just there that about uptake on cooling centers was maybe lower than you thought. Were there other challenges that you didn't necessarily foresee that came up with this? And then also, I mean, clearly there was a lot of time and effort going into develop this. So, and maybe part of the reason why you're here is obviously to share the information. But do you see uptake from other municipalities, or there's a lot of small cities like this that are probably wrestling with the same concerns?
Yeah, we began on this heat journey in 2018, 2019, before the heat dome, and there was a lot of door knocking. There were other priorities for municipalities. Wildfire smoke was a big one, or wildfires, flooding. In the interior, we have a lot to consider. And so it took a while to socialize it and to really communicate the importance of protecting individuals in the community from heat. So it's about pushing out the messaging. And now it's a bit of a different story with the heat dome, the lessons learned, and the new BC HARS framework that has come down as well. So there's now more guidelines and opportunities to engage with municipalities, as well as resources available to look at this closer and to plan. And so I'm really optimistic about what comes next in that area.
Okay. Great. Well, one more time, thank you. Don't go too far.